Hello, welcome to this video. Today we'll explore the heart, the lungs, the pleural membranes, the great vessels, and the trachea and esophagus. Uh, all these integrate how these structures fit and work together inside the chest. First, we talk about the heart. Although we usually imagine it is sighted slightly to the left, and the heart actually sits in the center of thorax, behind the sternum and resting on the diaphragm. The ventricles form most of the anterior surface, while the atria lie behind them. The heart is enclosed in the pericardial sac, which anchors it to the diaphragm and allows it to move freely with each beat. This is the ventricles and the atria. Right atrium. The right atrium receives the oxygenated blood from the entire body human through the superior and inferior vena cava, and from the heart itself through the coronary sinus. Inside, we can see the fossa vallis and a remnant of fetal circulation. The left atrium receives four pulmonary veins carrying fresh, oxygenated blood from the lungs. The heart valves prevent backflow between atria and ventricles. Pulmonary and aortic valves each have three cusps shaped like parachutes. They open during ventricular contraction and close abruptly during diastole and pressure boils and vessels. The heart receives its own blood supply from the coronary arteries. The right coronary artery runs along the atrioventricular groove and gives off the posterior ventricular branch. The left coronary artery divides into the circumflex artery and the anterior descending artery, which supplies most of the left ventricle. Venous blood drains into the coronary sinus and enters in the right atrium. Each lung is surrounded by two layers of pleura. The visceral pleura tightly attached to the lung surface, and the parietal pleura lining the inside of the chest wall. Between them lies a thin film of fluid that creates a sealed space. If the parietal pleura is punctured, air enters and the lung collapses, a pneumothorax. The right lung has three lobes. The left lung has two. One, two, one. The mediastinum lies between the lungs and contains the heart, great vessels, trachea, esophagus, and other structures. The lungs do not expand by themselves. They are passive. When the diaphragm contracts and moves downward, and when the intercostal muscles lift the rib cage forward, the thoracic cavity grows. The lungs follow this movement and air flows in. When this motion reverses, air is pushed out. The trachea descends into the thorax, just to the right of the aortic arch. It is supported by C-shaped cartilage rings and left main bronchi with branch into lobar and segmental bronchi. Behind the major vessels lie the esophagus. It travels down the posterior mediastinum and passes through the esophageal hiatus of the diaphragm before entering to the stomach. Together, the heart, lungs, pleura, trachea, great vessels, and esophagus form a tightly organized and independent system. Understanding their relationships brings the entire thoracic cavity to life. And this is all. Thank you for this day, and thank you, teacher.